my name is Lauren Kelly, and today I will be talking about Mary Breckinridge and the impact that she made on nursing. Mary was born on February 17, 1881, to Catherine Carson and Clifton Rhodes Breckinridge in Memphis, Tennessee. She was the second of 4 children and the oldest daughter. Her family was very wealthy and influential in politics. Her grandfather was vice president to James Buchanan, and her father was a U.S. representative from Arkansas, an ambassador to Russia, and a commissioner of Indian Affairs. She was very privileged when it came to school. She had many different tutors and went to private schools. She traveled a variety of places and went to boarding school in Switzerland and Connecticut. Like most other women of her time, it was encouraged to marry and not attend college. She ended up marrying Henry Morrison in 1904, but 2 years later, her husband died. Mary decided to become a nurse and went to a college in New York City. In 1912, she married again to Richard Thompson, and during that time taught French and hygiene. She and Richard had 2 children, but sadly both died. She and Richard divorced in 1920, and Mary took her maiden name back. During this time, the influenza epidemic was rampant. Mary worked in D.C. taking care of victims for a year, and then went to France with the American Committee for Devastated France. She volunteered for 3 years and organized disaster relief programs. She later was awarded the Médaille Reconnaissance of François. In 1921, she went back to Kentucky. During this time, the infant death rate was at the highest, and in rural Kentucky there was no access to good health care. She did a public health survey of the Appalachian Mountains in Kentucky, and the results showed that most of the women who delivered the babies were illiterate and did not have the training to do that kind of work. Women gave birth to an average of 9 babies with no prenatal care. Mary also discovered that there were no midwifery schools in the United States. After going to Columbia University in New York, she went back to Europe and attended the British Hospital for Mothers and Babies in London to be trained in midwifery. After being certified as a midwife, she toured different schools in Scotland to see how things worked over there. Soon the infant mortality rate began to decrease. In 1925, Mary took her knowledge back to Kentucky and started a school there. She started the Kentucky Committee for Mothers and Babies, which later became the Frontier Nursing Service. It was started using Mary's own money and 6 nurses who were professionally trained in midwifery. The Frontier Nursing Service served 700 square miles of Kentucky. Even though cars were becoming a modern way of transportation, the nurses traveled on horseback in order to reach the homes in the mountains. It was a very difficult job because of the mountains and lack of well-traveled roads. They had saddlebags attached to the horses that carried everything they would need for that day. They administered care as nurses and midwives and gave pre- and postnatal care. In only 5 years, 1,000 homes were served by these nurses. Mary was able to raise $6 million, and she used that money towards building a hospital, hiring a doctor, and building outpost centers. Families were not charged for their care if they could not afford it. Mary did not want to turn anyone away from receiving care. The infant and mother mortality rate went from the highest in the country to below average. When it became too expensive to send nurses to be trained in Europe, a midwife started the first midwifery school in America in New York called the Frontier School of Midwifery and Family Nursing. Since 1925, the Frontier Nursing Service has helped over 64,000 patients. They delivered 17,053 babies in the first 50 years of the service with only 11 maternal deaths. 250,000 vaccinations were given, and countless lives were saved. The school was also started in Hyden, Kentucky, and the Frontier Nursing Service still serves Kentucky, and people come from all over to learn about rural health service. Mary continued to give care by horseback until she fell from a horse and had to wear a brace. She still led the Frontier Nursing Service until her 80s and led for 37 years. She died at 84 in 1965 and is buried in Lexington, Kentucky, next to her children. Her legacy continues far past her age. The Frontier Nursing Service has now 6 healthcare clinics. The the Mary Breckinridge Hospital and Mary Breckinridge Home Health Agency. The American College of Nurse Midwives recognizes Mary as, quote, the first to bring nurse midwifery to the United States, end quote. She was inducted into the American Nurses Association Hall of Fame in 1982, and a stamp was issued in honor of her in 1998. Mary Breckinridge was the gateway to rural healthcare and saved countless lives with her determination and hard work.